It's basically allows the insurance companies to use the Medicare funds as a bank account, basically, that they can pull out. Mm-hmm. So it's a total scam, and the sad thing is, the people that can afford Medicare Advantage, and don't even think about it. It's just another payment because they have the money. Well, what they're doing is they're still undermining Medicare, and the people who will suffer first are the poor or the ones that really get sick.
Brother Jack, thank you. Let me say this, okay? We have a basic problem in our country, and that is we have effectively allowed a sect to lie to us and to make us forget something as simple as math. All insurance always does is pay a bill. And if you are being charged to pay a bill as opposed to not being charged to pay a bill, it will always cost less to not be charged to pay a bill. So this is important, folks. Think about it again. If I charge you to pay a bill, it costs you more than if I decide to pay the bill for you without charging you. But that's not how they want you to think. They being your plutocracy, the people who run the country behind the scenes. Because they want to have you believe that having insurance companies take the Medicare premiums that you have paid in all your life, and every working American pays 3% or so of their salaries to Medicare from the time you picked up and started working. Unlike Social Security, Medicare is paid on all of your income. Let me tell you a little dirty little secret, though. The rich have allowed Congress to define income in many different ways. And what they've done is, you notice sometimes we have a right-winger that would come on and say, if you were to tax all the money out of the billionaires, all the income from billionaires, it'll last you 1 year. And I'm surprised it would last that long. Because the billionaires' income doesn't come as income IRS classified like your income and my income, wages, etc. Their income comes from something called capital gains. Their incomes comes from borrowing from insurance companies and never paying it back because they have tactics that says if you are getting income from an insurance company, even if it's backed by your stock, that's not income, so you don't pay taxes on that. There are all kind of magical ways the rich uses to not let their income be considered income, right? So right-wingers, open your ears now, my dear brothers and sisters, because they pulled the big hoodwink on you. So when they come out and write a statistic that says, if we were to tax all the income of the rich, it would be done in one, and we'll still have to come back to the regular folks. That's not true. If all the rich owns more than 90% of all the wealth in the country, you have to be uneducated to believe that if they own all the wealth, how could they not own most of the income? Actually, they do own most of the income. Now, here's the thing. But because they classify income differently, things like Social Security, things like Medicare only goes on to generic income, regular wage income. And because it's only on that kind of wage income, the base that gets taxed is much smaller. Even when it comes to, even though when I say, Social Security taxes end at $140-something thousand or somewhere in that vicinity. But Medicare taxes go on to all income, but all wage income. It doesn't apply to capital gains income or any of that kind of income. So therefore, we don't even collect as much as we should for Medicare. And then they want some more. What is that more? That more is to say, look, insurance companies never used to insure old people over 65. Why? Because they get sicker. It costs them more money. Their profit margin drops. So what they say is that to hell with old people. We're not going to insure them. And then the government said, okay, we'll create a program called Medicare. And instead of having Medicare for all, Medicare for everybody, they only have Medicare for old people. In other words, they allowed the insurance companies to continue ripping off the regular middle class, etc. And then because the insurance company did insure old people, the government said, okay, we will create a program that insures old people. I'm calling old people as people that are 65, but 65 was still doing their stuff, man. All right. So the government decided to insure people that are 65. And then the parasites come in, our plutocracy, our oligarchy, our private companies that want to make money on you now. They come in and say, hey, the government is paying out, I don't know, on average, $8,000, $9,000 on every old person for that Medicare program. Imagine if we could tell the government, hey, why don't you let us do it? All right, we'll do it and we'll charge an extra 20% or so. And we take the headaches away from you and we create Medicare Advantage. And by the way, government, you can't give dental. By the way, government, you can't give eye coverage. By the way, government, you can't give ears and you can't pay 100%. Leave all those perks to us. You're going to pay us to make a profit and to give those perks, but you can't do it. So if you notice, traditional Medicare is great. They pay for anything you want because anything you need for your health. That's what Medicare pays, minus 20%. And then you have to get a private insurance company to pay the other 20%. If we got rid of Medicare Advantage, your government, we the people, could pay the entire bill because it's costing us more than 20% more to have the private sector run your insurance. They don't tell you that specifically. If you want to find the data, it's there. But they won't tell you that. And to make more money, they even start doing the things like you have to have pre-authorization for anything that you want to do. You have to get the insurance company to say, okay, do it. And many times they simply delay or deny. Delay or deny. Delay with the expectation that you will die, or deny if they know you will live. Okay? That's what we have. That's our healthcare and Medicare system, Medicare Advantage system. Why? It's the reason I tell everybody who can do it, who can take care of buying their supplemental themselves, or who don't care leaving the 20% hanging or paying the 20% themselves. Get traditional, get standard, get the original Medicare. Do not get the privatized Medicare Advantage. It's a scam. And the scam is even getting deeper. I want you to listen to this. Yesterday, as I was playing and talking about Medicare Advantage and Medicare, and the reason I'm doing a whole lot of this right now is because this is a time when they try to get you, they bribe you to get Medicare Advantage. They take you out to dinner. They take you out to lunch. They lie to you and say, oh, buy Medicare Advantage. And then the person selling you the Medicare Advantage, they make $2,000, $3,000 for every person they sell that Medicare Advantage to. If they can make that kind of money, you can imagine how much a corporation is making. You can imagine what the corporation is making. So I have a video to play with a story. And what I'm trying to do is bring real stories of where Medicare Advantage has actually affected people. And it's even affecting unions now, because many unions, in order to save money, they've fallen for the hoodwink. They've fallen for the hoodwink. And when people realize that they've fallen for the hoodwink, by then it's too late. And they're stuck with lousy Medicare Advantage.
We spend a lot of time deconstructing the news, trying to parse it into a form that everybody can understand. We try to find those little nitpicks where it flies above the fray, etc. If you really like these videos that we do, I want to ask a big favor. Please go ahead. Number one, subscribe to our channel. And number two, please join if you can. Thank you so kindly for watching. Keep watching. Please remember to share. We must populate the entire internet with our progressive message, a message that we know is what most Americans say that they want. So help us, please join.